Welcome to the Central Ohio 2022 Go Red for Women Luncheon. Please welcome our host, Yolanda Harris.
Hello and welcome everyone to the Central Ohio 2022 Go Red for Women Luncheon. Please help me welcome our guest for today's event, and that's going to be me, your host, Yolanda Harris. Stacy McKay was supposed to be here, but we learned she was exposed to COVID, so I'm going to be taking this over, going solo, and I'm so happy that you're here with me to help me celebrate the 2022 Go Red for Women Luncheon. Now, we are definitely in an evolving world. So I know that we're all going to send Stacy and the Sunny 95 morning show some good vibes and well wishes, hoping they all feel better soon. Now, I want to share just a little bit about Go Red, the state of women's health, and all the good stuff coming in today's program. Our goal today is to join forces to build awareness and do all we can to not lose more women, not one more, to heart disease or stroke. Cardiovascular disease impacts women of all ages, races, ethnicities, and backgrounds, yet women continue to be overlooked, symptoms dismissed, and significantly underrepresented in the life-saving research needed to treat, beat, and prevent heart disease and strokes. Research shows that heart attacks are on the rise in younger women and suggests that Gen Z and millennials are less likely to be aware of their greatest health threat, including knowing the warning signs of heart attacks and strokes. That's why it's important for all women at all ages to take charge of their heart health and encourage others to do the same. And we know these last 2 years have been hard. People are tired. Women are tired, making it even tougher to take charge of our health these days. Even those who normally focus on their health have lost their rhythm. Since the pandemic, 1 in 3 people are reporting lower emotional wellness, and 1 in 5 report lower physical wellness. And many of us have adopted unhealthy behaviors like skipping exercise, eating unhealthy foods, drinking more alcohol, and using tobacco. 1 in 3, which can all increase the risk for heart disease and stroke. Now, that's why today we're going to help you reclaim your rhythm. That means taking control of your health by making positive moves, little changes today for a healthier tomorrow. Reducing stress, if we can do that. Adding in more activity, we can all try a little more. Making healthy meals your go-to. It all adds up and helps us reclaim our rhythm, setting a new pace for a new year. Our hope is that you leave this event ready to be an agent of change for women of all ages and all colors. Each individual voice strengthens our efforts because together there is nothing women cannot achieve. One easy way to start the conversation right now is to share your unique luncheon experience on social media with the hashtag #GoRedCBus. #GoRedCBus. Show us your Instagram-worthy meal or snack for this luncheon today, or that little thing that you're doing to change. You never know who you may inspire. We also want to hear from you in our chat box today, so let's start with one way you'll reclaim your rhythm. Now, I know for me, I've got to try the exercise thing a little more, so I am going to commit that I am going to walk more. I'd like to try and walk 2 miles at least every other day, because that's something, that's a start. We all have crazy schedules. We're all super busy with work and kids and home and everything we have to do in our lives, but we have to take time out for ourselves. So let's see what everyone at home is saying. If you guys are putting in the chat, what are you doing to reclaim your rhythm to improve your health? I'm looking around, so make sure you put some stuff in there, you guys. We want to know what you're doing. Are you going to eat better? Are you going to work out? Are you going to go on a long walk, stress? Just kind of do yoga, maybe aerobics, or meditation just to deal with stress levels, because that is a really big factor in being unhealthy when you carry too much stress. All right. before we go any further, we want to take a moment and recognize some of those who are making the life-saving research, education, and awareness efforts of Go Red for Women movement possible. Our dedicated sponsors. You can't do this without sponsors. National sponsor, CVS Health. Life is Wise sponsors, Battelle, Big Lots Foundation, and Cardinal Health. Our additional lead sponsors include American Electric Power Foundation, BCU, Delta Dental of Ohio, Mount Carmel Health System, Nationwide, Ohio Health, and United Healthcare. We definitely want to extend a heartfelt thank you and all the gratitude to all of our sponsors and our supporters this year, so thank you. We hope you all enjoyed today's program, so let's keep it rolling as next we hear from this year's co-chair, Ola Snow, Chief Human Resources Officer for Cardinal Health. Her relentless support this year is reflective of her commitment to health equity and raising awareness so we no longer unnecessarily lose the women we love to heart disease and stroke. Let's give Ola some love in the chat with a quick thank you for her leadership as we welcome her.
Thank you, Yolanda. It has been such an honor to lead the Go Red this year for women, and what a year it has been. We are truly living in extraordinary times that are once again this year causing us all to move in that different rhythm Yolanda talked about. And so, what would normally be a great opportunity of fellowship for us to come together, see friends, connect over a meal in the same room, it's now this new kind of opportunity for us to connect through this digital experience. This new, ever-changing rhythm that we've been in the last couple of years, it's been such a hard adjustment, and let's be honest, it's stressful. Women in particular are experiencing significant amounts of stress as they juggle the worries of the pandemic, health, their families, careers, and their communities. It is no wonder that women are losing their normal healthcare rhythm. Our healthy habits are on the decline and deaths are on the rise. And researchers say that the pandemic will affect heart health for years to come. Even before the pandemic, heart disease and stroke claimed the lives of 1 in 3 women. And yet, fewer and fewer women realize that cardiovascular disease is their biggest threat. Yolanda referenced it just a few minutes ago. Awareness is declining. This decline awareness is especially alarming among women 25 to 34 years of age and with both Hispanic and Black women. This just isn't acceptable, especially when you consider women of color tend not to have equal access to health care, housing, or healthy foods. These women disproportionately bear the burden of cardiovascular disease, which you will hear about in just a bit. Ladies, it is time to rally in support of each other. We must reclaim that rhythm by prioritizing our health if we intend to change the world for ourselves and those people we love. And today I'm telling you, we can do this. We can be intentional about setting time aside for ourselves, promoting deeper understanding and education on this very issue. At Cardinal Health, we are committed to removing barriers to provide an equal playing field for our employees and the communities we live and work and serve. We know lives are at stake. We are focusing on health equity, wellness, mental health, and overall well-being, things that are truly at our core. And that's why we've collaborated with the American Heart Association since 2004 and worked right alongside Go Red movement since its inception. This year, we had an enormous amount of support. First, I'd like to offer my accolades and thanks to Uni Kim of Mount Carmel Health System, who led an extraordinary campaign and left some pretty big shoes to fill. Next, I'd like to acknowledge an extraordinary group of individuals who served, gave their time as our executive leadership team, helping not only to raise critical funds, but awareness. My heartfelt thanks to each and every one of you. And finally, well, I have a pretty fantastic, terrific wing woman, one of the best, in fact, with Congresswoman Joyce Beatty as my co-chair. If you know Joyce, you know that she is fierce, passionate and committed to this cause, and also so gracious to share her story with so many. Not just her personal story, but the story of health equity. She truly continues to be a champion for all women in the state of Ohio and has been relentless advocate for both Go Red and women's health. I am pretty excited for her to represent us. It is my honor and pleasure to welcome her to the program now, and I know that you will see her conviction shine through.
Well, thank you. The last 2 years were challenging for health, particularly for health equity. COVID-19 has exposed and intensified health disparities. The pandemic has caused a tidal wave, which will continue to have a lasting impact on health and the healthcare system far beyond the treatment of the disease itself. Increased deaths from this time are not only from COVID-19, but from diseases that the association is working to address. The decrease in life expectancy is greater among Hispanic and Black Americans compared to white Americans, calling attention to the inequities that persist. While the American Heart Association has long pushed for health equity, the pandemic, combined with the turmoil and trauma that brought historical inequities to the forefront in 2020, prompted the association to ramp up their already aggressive approach. The American Heart Association launched 10 bold commitments and backed them with action and urgency. An investment of over $200 million to fulfill them by 2024. They also changed their organization-wide impact goal, aligning around these words: every person deserves the opportunity for a full, healthy life. As champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. While we don't have the time today to dive into all 10 commitments, I do want to highlight just a couple of them and their progress that really underscores the association's dedication and work as champions for health equity. Their biggest investment infused $20 million into the Health Equity Research Network on prevention of hypertension, helping to better understand why uncontrolled hypertension is particularly acute in communities of color. And for systemic and historical reasons, it's a major source of health problems among Black, Hispanic, and Indigenous people. The American Heart Association is also committed to improving access and the quality of health care for under-resourced populations, which includes Medicaid expansion. I am proud to say that our voices from right here in Central Ohio and across the state relentlessly advocated for postpartum Medicaid expansion, extending the care for new moms and their babies from 60 days to 1 year. Yes, 60 days to 1 year. This impressive win goes into effect April of this year. Finally, the association has created a digital learning platform that will help healthcare professionals identify and remove barriers to care due to racism, adverse social determinants of health, and social needs of patients. Several new online courses are set to go live in the coming year through their new health equity portfolio. These courses are designed to educate professionals along the care continuum on methods to identify and to remove barriers to health equity. As we consider the scope of disparities and the work yet to be accomplished, it is my honor to introduce our next guest. But before that, let me tell you my story, and I think it will help as I introduce our next guest. I'm a stroke survivor. It seems like yesterday, but my story is very much like many of the stories you will hear today. So often, we don't know we're having a heart attack or a stroke until it's happening. You know why? I didn't listen to my body. And that's the biggest part I want you to know, to remember to listen to your body. Now, I had attended a luncheon, busy day, got back to my late husband's office, and so the story goes, I collapsed. I don't remember much of what was happening other than I went to reach for the telephone, it dropped, I collapsed, and I woke up in the hospital. It was very frightening to me. I spent months in the hospital, and I was lucky. I went to a stroke center as an inpatient, and it was there, physical therapy, speech therapy. But the message I want to leave about my story, follow all the instructions. As a matter of fact, get up an hour earlier, do more, because it is the attitude, it is the belief that you can be a survivor that will make you a survivor. And I know, I had electric shock treatments, I had physical therapy at 5:30, and let me end with, the physical therapy was the best, but the shock treatment was very painful. And as the doctor proceeded to give me the treatments, I asked him if there were any side effects, and he said yes. It tends to take the lines out of your face. So I asked him if he could do the other side. And that's my story. But now it is my great honor to introduce a powerhouse, a friend, Dr. J. Wando Olayiwahale. Dr. O is one of a very small number of physicians and women of color whose expertise bridges academic, healthcare delivery, health policy, and health technology leadership. Over the past 20 plus years, Dr. O has dedicated her career to addressing and increasing access to care for underserved populations. We are so incredibly fortunate to have her expertise and insight with us here today. And it is my pleasure now to present this powerhouse to you, Dr. J. Wando Olayiwahale.
Thank you so much, Congresswoman Joyce Beatty and Ola Snow, the co-chairs of this event. And thank you to all of the organizers of Go Red. It is such an honor to be here today with all the other speakers. What an incredible demonstration of love for women and their hearts today. So as was mentioned, my name is Dr. Wando Olayiwahale. I currently serve as the Chief Health Equity Officer and Senior Vice President of Humana, Inc. I'm gonna start off with a question. How is your heart, my sister? Now, I get a lot of text messages from friends and family checking on me. How are you? What's up? You good? And I can answer quickly, I'm fine, I'm okay, all good over here. But that 6-word text, how are you, my sister? How is your heart, my sister? From my dear sister/cousin/friend Somi, however, stopped me in my tracks. Weeks prior, in December, we'd lost her older brother to a rare cancer at the age of 46. A life taken far, far too early, and the pain was so unbearable for me and so many others. While we all grieved his passing, her pain as his younger sister was especially acute. So when she reached out to me to ask about my heart, I was speechless. And if you know me, you know I am rarely speechless. So let me digress for a moment to see who's in our audience. I'm pretty convinced that there are 3 kinds of texters out there. So in the chat, I want you to say which one you are. The first types of texters are those like my kids. They're 14 and 11 years old. The texters who respond to a message even before they've actually read it. To them and their iPhones, those little dots waiting there are intolerable misery. The second group are those of you that are like my husband. I cannot tell you how many times I've brewed on an unanswered text for hours, only to find out that he never read the text, nor did he pick up the milk that, I texted him about. And then there are those of you that are like me, the sweet middle ground. I got your text, I read it. When I've given it some thought or a moment, I will definitely hit you back. But when I got Somi's text, though, I was truly speechless. That question required some thought. I could not hit her back that next moment. The question actually perplexed me. The question did not allow me to do my typical "I'm fine" answer. So I want you to just ask that question out loud from wherever you are. How is your heart, my sister? As so many parents, grandparents, caregivers, aunts, uncles in this audience all know very well, it's always interesting when we're blindsided with the simplicity of the profound. How many times in our lives have our children or our nieces or nephews or grandchildren asked us why about questions that we cannot even begin to know or understand. And the thing is, I, of all people, should actually know my own heart. I'm a physician. I actually do know hearts. It's kind of what we do. So I want you to repeat, how is your heart, my sister? There are many answers to this question. There's a clinical answer, of course, to this question. As was said earlier, despite heart disease being the #1 killer of women, most women, and especially Black women like me, don't know much about the symptoms and prevention. Blood pressure and cholesterol are mysterious numbers on lab test readings, if we even get a test at all. In fact, only 1 in 5 of us believe we're personally at risk for heart disease, when almost half of us over the age of 20 have some form of it. We can also think about that as a social question. Unrelenting gender discrimination targeting our sisters has taken a serious, serious toll on our hearts. Stress results from a wide range of cardiac conditions, poor health outcomes, and leads to shorter lifespans. Racism and gender discrimination that we experience so regularly in our lives and in our nation is making us sick. Our minds and our hearts simply cannot take it. But the question is also a deeply emotional question. Last year, an article appearing in Vox described the incalculable grief endured by Black mothers like me. Vicarious trauma is an integral part of Black parenthood, manifesting every single time any Black child is the victim of police brutality or stories of bigotry are looped on the 6 o'clock news while we're putting dinner on our tables. These experiences are fomenting a crisis of mental health in the African American community, brought along by fear, hopelessness, and the seemingly impossible task of fixing centuries of hate. In fact, the 2020 Department of Health and Human Services report found that Black high school girls were 60% more likely to attempt suicide than their white peers. Now, to be sure, during the COVID-19 pandemic and following social justice uprisings, we raised public consciousness about the concept and consequences of shared grief. An influx of pandemic grief guides and scream circles to expressively vent frustration have encouraged us to confront our pain. But yet, as the pandemic restrictions are slowly easing, so too is the grief for many who have survived these last 2 years. But I'll argue that it's not so for the Black community. Because while one virus may be slowing, the virus of racism continues to spread unabated. There is no relief from this pain. There is no grief guide to salve the soul, and no primal scream loud enough to stem our sorrow. So we are marinating in collective mourning that also weighs on our hearts. So, how is your heart, my sister? No matter what lens we interpret that question, one thing is clear. Our hearts are complex. They're full, they're fragile. We love with them, we hate with them. We celebrate with them, we mourn with them. We dream with them, we fear with them. We share them, but we also protect and hide them. We experience joy with them, we experience pain with them. We dance with them, and we hurt with them. One of my favorite authors, Dr. Toni Morrison, famously wrote, and I quote, "The beat and the beating heart, love that, more than the eyes or feet, more than the lungs that have yet to draw free air, more than your life-holding womb. Love your heart, for this is the prize," end quote. So loving our hearts and caring for our hearts means that we need to understand them. Some of that work is actually pretty straightforward. First, we can start by knowing our numbers, like our blood pressure, our cholesterol, our risk of diabetes. Poor control of any of these factors significantly increases the risk of heart disease and can be easily tracked, tested, and often managed by your doctor. We can also try to adopt some healthy habits and get rid of some that are not so healthy for us. Smoking, excessive drinking, or even recreational drug use all impact our heart health. But there are plenty of resources to access to help you curb those behaviors, and many that replace that temporary stress relief that these habits often provide with the sustained dopamine of women's support and groups and companionship. And ladies, as we said earlier, we all know that we've got to do a little bit better job of moving more and eating less. Now, being in Zoom meetings for the last 2 years, I will be the first to admit that I personally need to get up and move more. But we also know that giving back also helps. Studies show that pouring out love is healing as well. My good friend Janine Broussard runs a program called Help Us Grow, or a HUG program, a reading program where seniors tutor reading to struggling youth from schools and communities that have been underserved, underfunded, and marginalized. While they have seen positive outcomes in student-based educational achievement and resiliency, they have also seen that this sort of giving back heals loneliness and depression in the volunteer tutors. We need to remember that our hearts are intricately connected to our heads. Our hearts are like physical recorders of all the thoughts that run through our mind: our stress, our self-doubt, our insecurities, our imposter syndrome, and our fears. That means as we love on our hearts, we need to love on our minds. Over my career, I've prescribed a lot of medications and treatments, And I've been asked so many times by patients for that one magic pill for blank, you name it, whatever it is. So get out your pens, ladies, because I'm about to give you a secret. I have found that there's nothing more potent and inspiring than having another sister who cares for your heart. And I mean all of it. Someone who you can be accountable to and be accountable for. When those cholesterol numbers drop a few points, the kind of sister who will jump up and down right there with you. A sister to share walks with, to do yoga sessions with, to share healthy recipes with, and to have a good old-fashioned soul-cleansing cry or laugh with. And to me, that is the magic pill. We cannot do this alone. And I know for sure that there is a sister out there right now who needs you to ask about her heart, like Somi asked me about mine. A sister just as ready to hold your heart in her hands if you will let her. Now, you may know Michelle Obama famously said, quote, "Friendships between women, as any woman will tell you, are built of 1,000 small kindnesses swapped back and forth over and over again," end quote. We should be comfortable with swapping our love back and forth with sisters. So in case you're wondering about that text, I eventually answered Somi back. And though my answer was just as complex as her question, this has made us mutually accountable for one another's hearts in every dimension. We check on each other's hearts every single day. So how is your heart, my sister? As I finish my remarks, I'm going to ask you to pull out your cell phones. I want you to send a sister who is on your mind those 6 essential words. How is your heart, my sister? Let that be the conversation that starts a journey of caring for your hearts together. Go Red.
Thank you so much, Dr. O, Congresswoman Joyce Beatty. Some inspiring words from inspiring women, strong, intelligent, and really passionate about heart health. Now, we've talked quite a bit about health equity and the barriers to care for many women. The results are devastating, and far too many women pay the price with their life. So let's take a minute and hear from Waukesha about her journey.
The day that my heart attack happened, actually, my husband reminded me that I was complaining of not feeling myself, but I wanted to go out. It was the first time that we would be out, at least for myself, in a few months. At the time, with my medical background, although I knew the signs and symptoms of a heart attack, because I was only 31 at the time, and I had just had a baby, so I was celebrating life, I had no idea that it was a heart attack that was happening. I felt this crushing of my chest, like my chest was just in a vice, and I felt like I couldn't breathe. And then I had the numbness down my left arm, the tingling, the chest pain up through my jaw and neck, and at that point in time I knew something was terribly wrong. This picture here is a picture of my little family. It's myself, my husband, and my 3 children. I take many, many photos. I like to kind of take photos in order to remember, because the day of my heart attack, I took a photo of my son, and I look back at it as that possibly being the last photo that I could have ever taken. When I was pregnant, a discussion about any heart-related issues was never discussed. I had no idea about the risks afterwards. Women need to be confident and know themselves so that they can advocate for themselves. You have to be able to express what you're feeling and have enough confidence to say, no, it's okay to disagree with a doctor. The type of heart attack that I had wasn't standard. So I had to kind of make my own moves. I had to figure it out for myself. And it's because I did that I'm here today. I survived for a reason. So I'm going to take every single opportunity that I have to live.
How compelling. Her story is our story. As I watched her tell her story, it made me think we do need sisters to hold our hearts. We do need to educate more. Here's an educated Black woman telling her story that will help other women. I simply want to say to her, thank you. Thank you for your courage. Thank you for now listening to your body. Thank you for allowing us into your world. It reminded me of my story. And to everyone with us today, this story can be your story. Listen to your body. And thank you, Waukesha, for telling your story. Compelling.
Joyce, my hope is that everyone here will feel inspired to join us in taking action to help save and improve the lives of those we love most in our community. Your gift helps the American Heart Association ensure every woman everywhere is aware and able to take charge and be confident about their heart health. This year, I am thrilled to share that your gift will make double the impact. Every dollar you give today will become $2, thanks to a generous matching gift made by Lisa and Bruce Bachman. Thank you, Lisa and Bruce. We also want to thank those who have already given, particularly at our highest levels, Corvite and Circle of Red. Giving today starts with one simple click. On your screen, you have the opportunity to make that life-saving gift. There you will see different donation levels at which you can choose to give. As you make that donation, we want to share with you one more story as you open your heart and consider that gift today.
So this picture is of my family. It's of my husband, Martin, and my daughter, Emma. This picture means a lot to me because this was the first picture that we took as a family after my stroke. My pregnancy was actually amazing. I never had any issues, and I loved it when she first started kicking. I went in on April 1st of 2020, but I did not give birth to my daughter until April 3rd, a little after 6:30 in the evening. So it was a long, drawn out birth. I stayed in the hospital for 2 days, so I went home on April 5th, and it wasn't until April 8th, and that is when I had my stroke. I woke up with a migraine, which is very usual for me. I've suffered from migraines since I was 12 years old. So I just would go about my day and hopefully it would go away, but it wasn't. My husband suggested that we go to urgent care just to make sure that everything was okay because I had just given birth. And so on their way to urgent care is when everything kind of unfolded, and I just remember letting out a huge scream, and after that, I don't remember anything. But it was terrifying to know that this is what happened to me, and the fact that he had to go through this. Thinking that I wasn't going to live. Well, the one thing that I've noticed about especially Hispanic women is we don't really talk about our health. It wouldn't be until something had happened to us finally start taking care of ourselves. You know, I was in pretty good health, and the high blood pressure only happened the last 3 weeks of my pregnancy. So I never thought that this could happen, but now going through all of this, I'd want women to know that they need to talk to their doctor and make sure that they be an advocate for themselves. When we are young, we don't think about that. We think, oh, we're gonna live forever and I'll worry about that later on in life. And no, it can happen at any age, at any time, and I'm proof of that.
We thank Andrea for sharing her story. Facing death, facing a situation like that is frightening. And that's why we're here. That's why we are spreading this message to know what to do to keep your heart healthy and spread the word and tell other women you know. Now, we want to personally thank each and every one of you for making life-saving miracles like the ones we heard today happen every day. Thank you for uniting with us and for joining Go Red for Women's fight for a healthier future, free of heart disease and free of stroke. Since 2004, Go Red for Women has had a profound impact on women's health and continues to be a champion for women to remove barriers to good heart health and well-being. Go Red for Women is addressing inequities in access and quality of care, ensuring all women are aware, engaging more women in research and STEM, and helping women take charge of their health. Next, several local leaders and experts will hold a robust discussion around these very topics. So please help me welcome back to the stage both Ola Snow and Congresswoman Joyce Beatty. And joining us today for the first time, Dr. Chelsea Moreland and Dr. Maureen Joyner.
Dr. O painted a picture that is a stark reality in healthcare. Disparities continue to persist when it comes to health equity and access to care. So, Dr. Moreland, we're going to start with you. From your lens, can you tell us what gaps that you see in the community when it comes to primary care?
There are so many gaps in the community when it comes to primary care. A number of those gaps include issues of transportation, issues of healthcare access when it comes to language barriers, and even cultural barriers. For the past 2 years, I had the privilege of working in community health, and about 80% of my patients didn't speak English as their first language. And so if we are not taking into consideration the context of their culture and who they are, we will have a difficult time coming up with plans that they can buy into and that they believe in. And the other thing I would mention is that nowadays, we think of primary care as reactive. We go to our family doctor when we have an acute concern, but primary care was intended to be preventative. It was intended to allow us an opportunity to intervene early in disease.
Those are excellent
Thank you for
points. Thank you, Dr. Moreland. Those are excellent points. When a person delays care or neglects primary care, then healthcare problems that could be managed fairly simply really snowball and become emergent conditions, advanced disease, and in some instances cause irreversible damage. A great example of this is hypertension or high blood pressure. It's often referred to as the silent killer because most people who have hypertension don't have symptoms and they feel good. The problem arises when it goes untreated, when someone has poor access to care or inconsistent follow-up. And then that leads to patients coming to see me in the emergency department when it impacts their vital organs, causing things like congestive heart failure, kidney disease, stroke, and heart attacks.
What I heard you both say so lovely was that preventative care is so key, but also around this cultural sensitivity. And I think that's something that we need to focus on. Having that lack of diversity in our medical professionals, that has to change around not only medical professionals, but also researchers. The reality is, if we can't change how women are treated in the medical setting, we can't change it until we change who is treating them. They want to see someone that looks like them and that they can trust.
You know, Ola, you are exactly right. When you think about women, and especially women of color, they are so underrepresented, whether it's in the medical field, whether it's in research, and let's not even talk about clinical trials. When we think about clinical trials and how women have been treated and the guidelines, so often we don't think about it, but it's important for us to share that the guidelines were not developed for women who look like me. Black women weren't. They're developed for white women. And of the female CVD clinical, they're trial participants globally. When you think about that, let's think about that. Of the female CVD clinical trial participants globally, now I want you to really process that as doctors. Nearly 80% of them are white, and only 3% represent Black women. I think that tells the story and why education is so important. Women, now let's look at it. Women occupy nearly 1/2 of all the United States jobs. But when you think about STEM, we're absent. You don't find us there because only 1/4 of the jobs in STEM we're represented in. But finally, Black women and Hispanic women are less likely to earn degrees in STEM. So I think another reason why we have to tell our stories and get it out there so our young girls can get excited about STEM. And so, Dr. Moreland and Dr. Joyner, first I want to thank you, but I just love to hear just a glimpse of what it's like for both of you to be female physicians and to see the lack of diversity that's in research and how it's impacting our healthcare. If you could just talk about that. Education is so important for us to tell our stories. Tell your story.
That's right. Well, over time, studies have shown that in areas of research related to things like pain perception, delays in care, even how we use certain calculations and scoring tools in medicine, that race matters and it impacts outcomes. I've seen it in my own experience, and patients have remarked to me about how vital it is to have people involved in their care that look like them. As an emergency medicine physician, my role is to quickly be able to establish a connection with the patient so that I can garner their trust and treat them effectively. So that's not to say that white physicians can't take excellent care of brown and Black people, but there is great value when a patient sees someone on their care team that looks like them. At the end of the day, when diverse people participate in, conduct, and contribute to research, then more diverse perspectives can be considered.
Absolutely. And I think the impact of the lack of diversity is actually twofold. We see that impact on us as physicians and women of color, and then we see the impact on our patients. As a physician and woman of color, I can definitely say throughout my career, one of the things that I've seen is that a lot of times people want us in the room, but they don't value our voice. They don't value the perspective that we bring to the table and the way that we are trying to advocate for our patients. And so the trickle-down effect of that is that not only are people not seeing many of us in healthcare and in STEM to be able to say, this is what I want to be when I grow up, but then when they do see us, are they getting our best selves? Because on the flip side, we're not necessarily in positions where we can fully enjoy our careers and give back what we want to give back. So we're almost discouraging young girls to follow in our footsteps, to go into medicine, into STEM. And then when we consider our patients, like you mentioned, Dr. Joyner, a lot of the algorithms and things that we use include race and ethnicity. And while they were intended to help minimize bias and help us to expedite diagnosing patients, the unintended consequence is that it creates a blind spot for many physicians and gives them a crutch where they misdiagnose someone or underdiagnose someone because they don't fit into the box. They don't fit into the algorithm.
Dr. Joyner, you said something to me yesterday that I'd like to share with the group, and that is the role that a Black woman played in the COVID-19 vaccine. Can you talk a little bit, just briefly, about that and the stigma that helped our community?
Sure. So Dr. Kizzmekia Corbett was one of the NIH scientists that really played a pivotal role in the production of the COVID-19 vaccine. And there were several people of color on the FDA advisory panel who participated as well. And I think highlighting her role as a part of that process really helped to remove some of the stigma of the COVID-19 vaccine among communities of color.
Thanks for sharing that. So you heard our panel talk today on how important it is as we think about that as well. So these women are powerful women, and seeing other women like them, look like them in the room is so important. So thank you both for sharing that today. Let's get back to the STEM conversation that Congresswoman Beatty talked about. The American Heart Association's Go Fred for Women STEM program is so critical and important. And after working with STEM programs closely, we know that young women and girls just aren't joining STEM fields for so many reasons, but one of those is simply as we've said, they don't see people that look like them and they can look up to. This is where the association is also doing a great job nationally and right here locally as well, introducing young women, specifically young women and girls of color, to our STEM field. This takes all of us, the educational system, the medical field, but it also takes corporations. And at Cardinal Health, we're in our 3rd year partnering, and Michelle Holcomb from Cardinal Health is serving as this year's chair because we feel so passionately about increasing the number of women and diverse women in this field. It will change, as all of you said, the research and the care that our young women and we receive.
Well, I think, Ola, you said it best. You said earlier that when we think about women of color, they disproportionately bear the burden of cardiovascular disease. And we've talked a lot about this. And we've talked a lot about how women must also be their own advocates. You've all talked about that. They need to be aware of their health threats. And I think it is our obligation, let's call us ambassadors, that we should go out and be ambassadors for women everywhere to ensure that all women have an opportunity to understand what we're doing. And I'd like to say it this way, that risk is not equal to being an opportunity offender. We don't want it to be an opportunity offender. So I think we have to talk more about what we're doing.
So from the physician standpoint, in primary care specifically, one of the ways that I try to empower my patients and to help them take advantage of those opportunities to intervene and decrease their risk is to never miss an interaction and bringing up the conversation of preventive care. And so I also serve in urgent care, and one of the things that I find helpful is when patients come in for their acute illnesses or bring their children in for acute illnesses, is to bring up the conversation, to say, hey, I see that you haven't had your annual exam. I see that you haven't had your screenings for X, Y, and Z, and how can we connect you? Do you have a primary care physician? What are your barriers to health access? And I think that goes a long way, because for many of us, we just get busy being busy and we forget about ourselves, and we forget that we can't pour from an empty cup.
I think you said it so well, and that next step is really empowering ourselves, have that confidence in themselves. But back to what Dr. O said earlier, let's be allies and sisters for each others. The reality is that most heart and stroke disease are preventable, as you've talked about today, and we can do this with a healthy lifestyle. But as we've heard today, there's no secret to anyone that the pandemic and these last 2 years have been taking a toll, and it's not getting any better for many of us. I've seen it in my role at Cardinal Health, and to say it's taking on a toll for women is absolutely an understatement. I said earlier that women are leaving their roles just as much, if not, if they're breaking through that glass ceilings. We just don't have the bandwidth to take care of ourselves, and we've got to make this a priority, not just for ourselves, but for our sisters as well.
You nailed it, Ola. I can definitely say that over the past couple of years, we've seen stress levels skyrocket. And so for women who oftentimes are the backbone of our families, are the backbone of our communities, we're not only seeing stress levels being up, we're seeing unhealthy coping skills up, such as drinking or smoking. We're seeing inflammation levels up, hypertension is up. And then the trade-off of that is that our mood is down. Our energy and motivation to do anything different is down. And then you add in the complexity of joblessness throughout COVID-19, and we created kind of the perfect storm. And so one of the things that I've adapted recently is this mantra that friends don't let friends die from heart disease. And so when we are at work and we are tempted to order out or eat unhealthy, instead of encouraging my colleague, oh, have that extra slice of pizza, or not eat the salad that they brought that day, I'm making it intentional to say, you know what, let me join you in that. Let me support your healthy decision. Because if we don't empower one another to do it, unfortunately, instead of the months and years that we would have had to intervene and prevent heart disease, we'll have it minutes, we'll have hours when they are visiting Dr. Joyner in the emergency room.
It really saddens me every time I see someone come into the emergency department with a condition that could have been prevented had they sought care sooner. But the good news is we have the power to make a difference and change the trajectory of cardiovascular disease and how it impacts women so that we can improve health outcomes overall. We can take charge of our own health and encourage our women in our families, our sisters, our mothers, our girlfriends to really be advocates for their own health, to prioritize their health, preventative care, and self-care. We can advocate for improved healthcare access for all people. And we can support the programs that help to encourage diverse students to pursue STEM fields and careers in healthcare. When we do these things, we empower women, and when we empower women, we empower entire communities, because women are, like you said, the backbone in so many communities. We're far from done with this. It's far from over, but we can make it so that heart disease doesn't have to be the most common threat for women's health.
Well, thank you, ladies. We really appreciate that conversation. And I don't know about anyone else out there, but that conversation really has motivated me. I'm sitting here thinking, oh, I need to call my doctor when I get back to the office because I need to schedule my annual physical, get some blood work done, because we need to know our numbers. We need to know our risks. So I hope that you too are getting the same motivation that I'm getting hearing these ladies. Now, as we do start to wind down our program, I want to share an exciting update. Just in this hour, we have collectively raised $5,000. So thank you for that, bringing this year's Go Red for Women movement fundraising total to $1.2 million. So yes, very good, and we appreciate it. So keep those donations coming in, and this really is a big number that will make a big impact. And when I think of making a big impact, I think of the work and support of Big Lots. So please help me welcome 2023 Go Red for Women Chair, Joyce Workus, Senior Vice President of Marketing with Big Lots.
Hello, everyone, and thank you, Yolanda, Stacy, and everyone involved in pulling together a fantastic program today. My name is Joyce Workus, and on behalf of Big Lots' 37,000 associates, I'm honored to be joining you to celebrate Heart Month. As a national retailer, it's important to know our customer so we can make her feel special when she shops at her neighborhood Big Lots. We like to describe our customer as the everyday superwoman because, like all of you, she goes out of her way for the people she cares about, and she loves to give back to her community. We want to empower her to live big every day and to experience all of life's moments. We also want every customer to know that we care about the causes that are closest to her. But sadly, we all know heart disease and stroke lead to 1 in 3 deaths each year, impacting her friends, loved ones, coworkers, and those she cares about. Like many of you, this cause is very personal for me, having cared for family members with heart disease. These experiences pushed me to consider my own habits and how they impact not just my own life, but those around me. And as a result, eating healthy and working out have become an important part of my routine. Big Lots cares deeply about changing the outcome for women everywhere, so we can all live bigger, longer, and healthier lives. That's why we're proud to support the American Heart Association as a Life is Why retailer and National Wear Red Day matching partner. To bring this partnership to life, Big Lots and the Big Lots Foundation pledged up to $1 million over 3 years to match donations made to the American Heart Association and National Wear Red Day. This year, our donation match helped the AHA raise over $3.4 million. We're also in the middle of our second Go Red for Women in-store campaign, where we invite customers around the country to donate to the American Heart Association at the register. With the help of all of our associates and generous customers, we've raised more than $500,000 so far this year for women's cardiovascular health. Our hearts are full of gratitude for every donation that made this possible. Thank you and congratulations to Ola and Congresswoman Beatty for leading an impactful Go Red for Women campaign this year in Central Ohio. I'm honored to continue your incredible work as chair in 2023 and serve alongside all of you in making a difference in our communities. Together, we can continue to go big for Go Red. Now, it's my pleasure to introduce you to Nancy Toby, Executive Director for the Central Ohio American Heart Association, for closing remarks.
Thank you, Joyce. I want to start by thanking everyone who participated today to bring this amazing experience to life, to shine a light on the #1 killer of women while elevating the critical role health equity plays. And I want to thank each of you for participating in our digital experience. It is my sincere hope that you leave here today inspired to take action for your own health and for the health of the women you love. I want to thank each of you for opening your heart with a gift to our mission. The gifts you've given today allow us to fund groundbreaking research, educational programs, and provide tools and motivation to help women reduce their risk for heart disease and stroke. Locally, we are funding more than $10.3 million in active research to help bring scientific discoveries to life. Together, we are giving people the gift of time, more moments to laugh, to love, to discover new things in life, and to make a difference. And as we think about making a difference, I want to close by highlighting 2 local individuals who are impacting the lives of those we love in our community and countless lives across the country and globally. This year, 2 of our very own Columbus-based physicians and dedicated association volunteers authored National American Heart Association statements. These statements will make an impact all around the world for generations to come. First, earlier this fall, Dr. Lakshmi Mehta of The Ohio State University Wexner Medical Center authored a policy statement, Call to Action, Maternal Health and Saving Mothers. This statement calls attention to the tragic fact that mothers across the country are dying during and after childbirth, a trend that is disproportionately impacting women of color. It shines a light on the fact that as maternal health death rates are declining across the world, they are on the rise in the U.S., making heart disease not only the #1 killer of women, but the #1 killer of new moms in this country. The statement sets a new policy agenda to ensure healthy pregnancies, healthy births, and healthy moms. The statement provides compelling evidence for proven strategies to reduce overall deaths and address racial disparities in maternal health. As you've heard today, we are on our way here in the great state of Ohio with the expansion of Medicaid for new moms and their babies. Second, I want to highlight Dr. Joshua Joseph from the Ohio State University College of Medicine. Just last month, he authored an American Heart Association scientific statement calling attention to the fact that less than 1 in 5 adults with type 2 diabetes in the U.S. are meeting optimal heart health targets. As Dr. Joseph said, this new scientific statement is an urgent call to action, as less than 20% of those with type 2 diabetes are successfully managing their heart disease risk, and far too many are struggling to stop smoking and lose weight, 2 key cardiovascular risk factors. The statement addresses the gap between existing evidence on how best to lower cardiovascular risk in people with type 2 diabetes. The American Heart Association believes every person deserves the opportunity for a full, healthy life. It is no doubt with local leaders like Dr. Joseph and Dr. Mehta and everyone we've heard from today that together we will achieve this. As we wrap up for the afternoon, I'd once again like to offer my sincere thanks once more for each of you who attended, to all of our speakers, sponsors, and supporters that made today's program possible. I hope you feel empowered to take charge of your health and the health of our community. Also, a special thanks to our incredible board of directors for your leadership, guidance, and dedication to the mission of the American Heart and Stroke Associations. We look forward to coming together in person at our upcoming Heart Ball in May and Heart Walk in August. We are so very grateful for our volunteer leadership who are chairing our future initiatives. Our work would not be possible without their support. Together, we're leading with our hearts and will continue to stand as a relentless force for a world of longer, healthier lives. Be safe, stay healthy, and enjoy your afternoon. And as always, thank you for going red.
It's been 2 years. We're tired. We're burnt out. We're just trying to get by. But today is the day. It's time to reclaim your rhythm. Pick your playlist and put on your favorite red look. With your jams turned up, get moving. Bring the good vibes and take back control of your health and mental well-being. Little steps add up to big changes. From dancing with your kids in the kitchen to grooving with your girlfriends, staying active is one of the best ways to keep your body and mind healthy. Stress can lead to unhealthy habits, and managing stress means managing your health. So reclaim control of your schedule and build in time to invest in a healthier you. Know your numbers and make moves to help keep your blood pressure on track. Go Red for Women will be here every step of the way. So let's do this together and create healthy habits today that will lead to healthier tomorrows. How will you reclaim your rhythm?